Hi everyone, I'm Claire.
And I'm Ben.
And we are Your Dental Besties.
Making dentistry fun.
And it is very fun today because we are doing a little game and we're going to call it Bleach Bum.
Okay. I did wonder why I'm here in my Skrubz.
Well, you know how I just like to wear Skrubz.
Shopping, gym.
You're taking the mickey, but like I genuinely, they're so comfortable, aren't they? So comfortable.
I saw someone yesterday getting off the train in Skrubz.
Athletic wear now.
Yeah.
How do you feel? Because you're wearing Skrubz.
I'm wearing Skrubz. Honestly, these are the best Skrubz I've ever worn. I'm not just saying that because I think when you hear it on a podcast, everyone will be like, oh God. But like genuinely, I was like figs through and through. Like I would recommend them to everyone. I thought the best like uniform ever. I think it's because they were different.
Yeah.
But the problem is they're so bloody expensive.
And then you're having to ship them from America.
And then if you need to return them, it's a faff.
Yeah.
So yeah, I tried these and oh my God, honestly, I love them.
So I've been using these for a while. I literally, as soon as I went to a show and saw the Skrubz and saw that they were kind of
I remember we were there, we were talking about it and I was like, I want the burgundy ones. And you were like, I'm going to go try them on.
And I went and tried them on and I bought, I think 2 pairs that day. And I've never looked back, genuinely never looked back because they're more comfortable, they're more stretchy. The sizing seems to be better and the colours, everything. And I've just never got figs since then. I wear these all the time. I love this colour, by the way.
Yeah, I know. This was not planned at all, but we didn't know anything, did we, about what we were bringing?
No.
So if you are watching on YouTube, you'll be able to see my trainers.
I need your trainers on.
You really do. And you've got black and white trainers on.
And then you should have my trainers on.
We're fully coordinated today.
We have literally we look like we've rocked up and planned this.
Is it planned? No.
It's not planned, but
I'm properly impressed. Also, what I like is it's not just a V-neck.
Yeah, because you've got the t-shirt style on.
I've got the t-shirt style. I actually really like it because sometimes, because I wear a chain, I know I shouldn't, CQC.
But if it's underneath there, you can't see.
It's underneath there, so you can't see it. But also sometimes you get like splattered on your chest.
Yeah, that little V gets a bit of a splat. Yeah, I'm
gross.
A big fan of t-shirts. So I was saying to them, I was like, oh, we need a girls one. I want a t-shirt. But yeah, no, this is, and the quality of this, like this material. So I've got the bleach proof ones on.
Bleach proof?
Yes, so bleach proof. Did you not think it was really weird that I was putting bleach on my figs earlier?
I thought you were just touching your bum. Well, actually, that's a good point because I got... Do you remember during COVID and they had to like bleach the floors and everything?
Yeah.
The mop slapped up my leg and ruined a whole pair of trousers. And that was like 50 quid.
Yep. Down the drain.
I use them to clean in now.
Dental nurses are always covered in bleach.
Sodium hypochlorite forever.
Yeah.
We have started wearing black uniforms in our practice.
Yep.
Within like a week. It's all over the legs.
Yeah, bless them. And so, funny story. I worked at a practice years and years and years ago. Gosh, it must be about 10 years ago now. And one of the girls was wearing her, like pumps that are made of like a material. Yeah. So black pumps. And I think she was like mopping the floor or she was doing something. Anyway, she spilled like loads of bleach on her shoes. So one foot, the whole of like the front of her shoe went completely kind of like nude coloured, like skin coloured.
Pinky, doesn't
it goes like a pinky colour. So someone actually got like a load of felt tip pens and they drew toes. So when she was wearing those shoes,
oh my God, that's so
yeah,
gross.
they were like toes. So I got in touch, knowing that we were going to do Bleach Bum game today. I got in touch with her. I was like, you need to send me the picture of those shoes, but because it was so long ago, she couldn't find it. But they drew like toes and then it had like nail varnish on. And honestly, at first glance, it looked like she had like her feet out. Yeah.
Minging.
It was so funny. But okay, so we're going to do a little game. Now, I'll be honest with you. I'm going to show this is for the YouTube viewers, the trousers that I've just ruined. I have sacrificed a pair of my figs for this game, okay? Because I don't wear them anymore because I wear Skrubz. So I thought, right, I'm going to sacrifice these. If everyone on camera can see, I literally got my hands in bleach and put them on my bum, and obviously it's bleached them.
But it was burning you, wasn't it?
Yeah, so that's why I'm not doing it in these, because I'm going to put the bleach on these, but I'm not doing the blinking bum thing. I burnt my bum doing that. So yeah, it was pretty intense. So that's hence bleach bum.
But that's what we see all the time. And the thing is, if a practice is buying Skrubz for everyone, not just for nurses, if they're supplying them, and then within like 2 days they get sodium hypochlorite on them or whatever else on them, it is a shame because they look scruffy and you can't keep buying. How much is Skrubz postage? Because they're UK based, aren't they?
They're UK based. I to be honest with you, I think so. I think it's about £25 on average, because obviously £28 for a pair of trousers, and I think postage and package is included. I could be wrong. I will correct myself if I am, but I'm pretty sure when I've bought a set of Skrubz, it's been like £50 for the set, or around about the £50 mark, compared to, as you were talking about earlier, wear figs, which is like like you know, if you're going to get a set, then you're looking at £120.
That's a lot.
It is a lot.
And I think the figs were really good to start off with because they were like at the forefront of
looking good at work. Yeah. And I think I look good in these. So
I really like the colour.
I'm in love with this colour. I don't. Would you say it's a raspberry? What would you say it is? It's not a purple and it's not a burgundy.
It's literally like the middle of my shoes.
Yeah.
If you cross the pink and the purple.
Yeah.
I really like it though.
I'm a big fan. So let's do the game. Okay. I've put like because I don't want to burn myself again. I've put like something underneath my trousers so I don't burn my skin. A little protective coating.
Oh, this is what this is for. I thought you were advertising teeth whitening.
We're sponsored by Domestos. No, I'm joking. Oh my God, no, don't put that in your mouth to bleach your teeth. Could you imagine? Okay,
so I am your glamorous assistant.
You're my glamorous assistant. You're going to put some Domestos bleach. You want me to do it whilst I've got gloves on?
Yeah.
So if you hold that up, I'm going to do it really carefully because I don't want to splash
If you
anything.
get bleach on my Skrubz.
I know, now that you've got new
Mine
Skrubz.
aren't bleach proof.
Okay, I needed a little bit because I'm just going to do like a little... Oh my goodness. Ooh, that smell is so strong.
It smells good though, doesn't it? Do you just
It's
want me to
clean.
chuck this on you, yeah?
Don't you dare. Okay. I'm going to put my finger in so everyone can see. It's wet.
It's definitely wet, I can see it.
Okay. I am actually really... I don't want to ruin these ones because I really love these
Do
colours.
it. It's a science project. Do it. You need more than that.
Do I? Oh, okay. Okay.
Weird, because it feels like it's not going in.
It's like almost waterproof.
Do you want to put more on?
I don't. No, that's good. I've got like a little patch and that's where the little patch is. Okay. And then we let that set. So actually, when I did the wear figs, that turned really quickly. So
It did. It was like, like 3 or 4 minutes? Didn't take long at all.
And that's not turning at all. Oh, look, I'm looking at it now like, please don't, because I really like these trousers.
Right, we've got the rest of the podcast to get on with, so we'll come back to that.
In a second. We'll come back to that. Let me put that somewhere. Can you put that in the thing so we don't bleach the carpet? The producer will not be happy with us if we start bleaching the carpet.
Him and you rug.
We just want to take a second to say thank you to our sponsors who want to show their support to hygienists and therapists by sponsoring this podcast.
So we've been super picky because we only want to work with brands that we endorse, use, recommend, and feel like you could benefit from knowing about. We do want to say a real big thank you to Skrubz, Boutique Whitening, Dr. Hef's Mints, and Oh My Gob.
Details for our sponsors can be found in the show notes.
And if you want to sponsor season 3, then get in touch.
On with the show. Okay, so whilst we let that set, it's still not turning. I'm not going to stop looking at that now. Let's talk about nurses' wages. Now that we've talked about the nurses getting covered in bleach and looking like they've...
For nurses.
I know. We squirt them with bleach. We make them work really hard.
Run up and down the stairs 100 times a day.
And then we don't pay them enough. Well, we don't. I would. I think they should be paid so much more than they are because they are such a valuable member.
So... I'm going to go back to COVID as a point. So I think COVID was a point where a lot of them thought, okay, this isn't great anymore. They were brought into the practice and do you know what? We had to wear those respirator masks, the gowns. It was a lot of pressure on everyone.
Yeah.
And I think maybe they thought, oh, this just isn't for me or whatever.
Yeah.
I just don't understand why a practice would pay agency £20 to £25 an hour for an agency nurse, but won't give a nurse £15 an hour who's been there for 10 years.
Yeah.
It just makes no sense to me. Yeah. But I do feel like since that, I feel like a lot of nurses left, went to agency, and then slowly, the past 6 months or so, they want maybe a bit more stability.
Yeah.
So they're applying for practices again. and they're getting paid better, maybe still not what they're worth.
You can see why they do go to agency though, can't you? Because
100%.
yeah, but you're right though, because then that's like traveling around, and they're self-employed as well, so there's obviously negatives for that too. But I feel like they're the first ones in the practice, they're the last ones to leave. You know, they have to know as much as a dentist, because they have to know what the dentist wants before the dentist even has to ask for it. So the amount that they actually need to know is up there. I just don't know where it all kind of stems from, that they don't get paid.
It goes back. I think it goes back to the fact that nursing was an apprenticeship, so people could leave school and go get a job straight away in a dental practice. They'd be trained up by the dentist or by another nurse within the practice. Were they called auxiliaries? Dental.
Yes, I think so. Yeah.
Or assistants or something like that. And then that's how it was for years. So they were always deemed to be like, from a dental point of view, like, we've gone to uni, we've got like university fees and things. You're an apprentice, so therefore your wages will be lower. I think things have changed. I think the times have changed. Like, cost of living crisis is astronomical. And they have to study really, really hard. They do. Like, that course isn't easy. So I don't know. Is it that? Is it maybe practices thinking that they are expendable? Like, they can just get rid of them and get another one?
The turnover's really high sometimes. And I think it's always a real negative when you start to see that the nurse turnover is really high, because being clinicians, working with a nurse who likes being there, who's really like optimistic, hardworking, valued, that you can tell the difference between a nurse that feels like that compared to a nurse who doesn't. And I think the team is really important. Like, the business can't run without the team that's helping the business run. And I think we should look after them. And I think sometimes paying that little bit more and getting them to feel really valued and happy where they are, and having the team stay the same team for a long period of time, I think that's quite a valuable thing. I think it's something worth investing in. I think patients like it when they're seeing the same team again and again and again.
Yeah, but I'm on that dental nurse forum. I don't know if you're on it.
I don't think I am, actually.
On Facebook. The only thing I go on Facebook for is the hygiene therapy forum and the dental nurse forum. But I'm on that, and it's so sad because some of them have been qualified for 20 years. They've got like post-grad certificates. They're getting paid like £12. And it's like, come on.
Right, okay, yeah.
Like, come on. That is unfair. And I think if you are having to sacrifice the wages of someone to make your business work, then the business isn't working. And I think that's a clear sign.
Yeah.
It's not working. Like, £15, £16, £17 in dentistry isn't that much money.
Not if they're willing to pay locum dental nurses £25, £20.
When you think about it, it's like an extra. If you sold like 3 bags of TPs, maybe the profits from that, £3.50, £4, would be enough to cover a nurse's wage increase. It's not that much.
Yeah.
I just think they're undervalued. The thing is now, there's no training schools.
Right, okay, so it's all like online, is it?
Well, there are some online, but there are hardly any training schools anymore.
Yeah. But what about the fact that you need, like, what about sedation nurses? Are they making more money because they've gone and got their sedation training? Is there incentives there?
I don't know. It's incentives, isn't it?
Yeah.
I think, you'll pay for my course, but yeah, I appreciate that. But am I going to get paid more money to do it?
Because actually that's a lot more work than you need to do. Like, that's quite sort of... You need to be you could become like an expert in sedation nursing.
Yeah.
But then there's no, there's no sort of remuneration on that. So where's their career progression? Is it not really a career progression there?
I don't think there is much career progression. Actually, I say that. I think there is, but I don't think it's as abundant as what it would be for dentistry, for dentists and for hygienists and therapists.
Yeah.
I say that because I've got so many bosses. I keep trying to think how to differentiate them. One of my Eastman bosses, Marie, she's deputy and she's a dental nurse.
Yep.
But she's obviously gone into the management and leadership side of things.
Okay.
Done very well. But I think they are there, but it's because of people like her.
Yeah.
Kind of being that like spearhead and really just driving for change.
I guess that feels like that's the career progression. When I was in the army, when you were a dental nurse in the army, your career progression was when you got promoted, you'd be then going into practice management. So then the courses would be aimed at practice management. So like once you became a corporal, you wouldn't be a corporal dental nurse, you'd be a corporal practice manager. So is the career progression that you start getting more into management? Because I don't know.
I don't know. I think if you're a nurse in practice, your opportunities to develop further are quite limited. We'll see it all the time. What are my options? Practice manager or a hygienist or a therapist?
So you see a lot of people go on to do hygiene therapy, don't you, from nurses?
A lot of people go on and do hygiene therapy, do it, and I don't enjoy this either.
Yeah. I did a poll in the Hygiene Therapy Forum a few years ago for a company that wanted to know this information. So it's only like a poll within the forum. And I asked like how many people were a dental nurse first. And I think it was like high. It was like 83% or something of the people that voted in the poll had been a dental nurse first. I think it makes for a good hygienist and therapist. I think it's changing
because when I done it, I think when you done it, it was the diploma. So you could use your dental nurse qualification. And then like an access course. That was enough to get on the diploma. Now it's degree. You need your 3 A-levels or an access course, your dental nurse and something else. Like,
so you're going from school, so you might not have done the work.
So you get more school leavers now. So I think that'll change over time. But I think your nursing skills are invaluable.
I think it makes for a much better hygienist therapist not criticising anyone that's not done dental nursing, but it definitely opens your eyes to... I think when you come to do the course, you've already got like a little bit of a step on.
You know how practice is run. You know what stock's like. You know what kind of...
the terminology.
All the terminology. Communicating with the patient. Complaints handling. You can navigate all that a lot more easily.
And I think... so I think it does help. But I see what you're saying, actually. I can imagine down the line, it's not going to be so many dental nurses that are moved into hygiene therapy.
And that's a shame because they've got lots to offer. So... they should be able to do more.
I can see
radiography. They do the radiography course, but very rarely are they allowed to take radiographs.
Well, other things as well, you've got the oral health education, and I could see how that could be used.
That could work. I once went to a practice in where was it? Plymouth, I think it was, and they had an amazing model. So it was a new practice, start-up, and your initial appointment was with the therapist who'd done your exam and then referred out. So if you needed more kind of complex work, they would refer to the dentist. If they needed maybe hygiene work, they would refer to a hygienist or do it themselves. If they needed a patient to get to a point to then have kind of step 2, they'd refer to the oral health educator.
Okay.
And it worked well.
I like the idea of by the time the patient comes to me, even if the oral health educator hasn't, been hands in mouth, but has been able to, they've gone for the consultation, they go through to the oral health educator who's like, right, we need to get you onto this electric toothbrush. So here's a voucher to buy it. This is how you use it. This is what you need to use between your teeth. This is the colour TPs, whatever. So by the time they come through to me, they've got the tools. I just need to then hone those skills and do the treatment. So I do like the idea of that because otherwise my first appointment, I'm trying to say all of that as well. So, but can a dental nurse would that appointment be paid for? So the dental nurse gets like extra money maybe from that?
I don't see why not.
Because that could be a way of getting a bit more as a dental nurse,
if you think, okay, your plaque score's 100%, I'm seeing you for a hygiene visit today, and your bleeding score's 100%, we'll do the hygiene today, clear everything off. Straight after this, we're going to book you in with your health educator. I want you to have 4 appointments with them. And then come back to see me for a review. They'll pay for it, surely. They'd have to.
But so they see it, and that could be a way for a dental nurse to sort of be making that a little bit more because they're offering a service. I don't know how much they can actually do. I need to look into that a little bit more because I know that they can apply fluoride, can't they? And
obviously, if they've done the course. I don't know. I feel sorry for them. As someone who was one, it is really hard.
I agree. I just think I value them so much. I just think I can't work without one. And
that's the thing. We can't.
So we all can't work without one. Every clinician. And so effectively, they are needed to run a business. You cannot run the business without them, yet they're
not paid enough. Also, when you think of our registration fee, it's the same as theirs.
Yeah. And they are registered and liable as well.
Yeah.
So they have a responsibility
And
too.
they have to pay their indemnity. I don't think their indemnity will be as much as ours. But how does that work?
They've still got a responsibility to stay on the register, do the CPD, stay on the register. You know, if anything was to go wrong, they can be called into the situation as well. So
It's a much greater fee, isn't it? For out of a dental nurse salary than a hygienist.
Yeah, so when you look at the percentage wise. Yeah. So their GDC is the same amount as our GDC. Yeah. So, and I think a lot of places though, they like to have apprentices. Is there like a set amount of time before they have to be qualified by a certain point? Because I've worked at practices before where there's been a team full of apprentices, and I feel like, who's the person in charge of their training? Because surely you can't just have apprentices teaching apprentices.
Well, I think it's 2 years. I think they have to be on a training course within the first 2 years. I've also worked in an NHS practice where all of the nurses were trainees, and they had a PowerPoint presentation like once every 2 weeks, or like a video that they had to watch. That was their training.
Right.
And it wasn't anywhere near what I used to have to go after work on a Tuesday. It was like 3 hours. And my tutor, Paula, was amazing, but like strict. Like we had to know our stuff.
Yeah.
And it was an intense course.
Yeah.
And I'm just like, the quality, there's so much. The thing is, when you do your dentistry, when you do your hygiene and therapy, I think the quality of the education is somewhat standardized. We're all doing roughly the same thing.
Yeah.
Whereas I think nurses, I think it's hugely different.
So do you think there needs to be courses created that, because I think dental nurse, if you said to a dental nurse, like, would you want to go on these courses where you actually went on the course, you were taught, because I think a lot of them are sort of left to go into practice and they almost physically work like a dental nurse who's already qualified. And like you say, there's been teams before where they're all training, they haven't really got that person there to oversee it and do the teaching. Yeah. I think they would be like, yeah, I'd like to go on an actual physical course and do sort of sit down learning. I think that
also be social. Like you make friends with the people that are going through the same thing as you. But I think the same if you ask dental nurses, do you want to go on this course? And might not make you do anything more, but it's going to kind of broaden your knowledge.
Yeah.
I think they'll be like, yeah, one, the cost.
Yes.
2, am I going to get paid any more for doing it?
Because if they're getting paid, like, you know, lower than they, you know, in the current climate, it's difficult to live, isn't it? So they're not getting paid loads. And then there's a course that they could go on, but it's like £200. They're going to maybe be like, I can't afford to pay that. Plus as well, I'll do it. I don't get any more money for it.
So what's the point?
I
know it's not all financially, it shouldn't all be financially driven. And you do want to kind of do it for your own progression, but it is a shame, and I do think more needs to be done with nursing.
Yeah. I think we should empower them. I think that they are they should recognise, and I hope they recognise they're such a valuable member of the team and that we actually all absolutely love them. So we need to figure out what we can do to help.
Yeah. No doubt we'll think of something.
Yeah.
So stay tuned.
So on that, I actually have an agony uncle that is to do with dental nurses. So let's go on to it. Let me find it first. I'm lucky that I have a dental nurse. So this is from a hygienist or therapist.
No, you're not lucky.
Exactly.
Why do you have to be lucky that you've got a dental nurse?
It's good that you have one, great, but it should be a prerequisite. It should be like, that is just, I get what you're saying.
I'm so grateful. I'm so fortunate. No, actually, that's just what you need.
It should be the standard. Yeah, it should be the standard.
It's like saying, I'm lucky I have a dental mirror. I'm lucky I have a scaler.
I'm so glad I have a probe.
Yeah.
Thank you for my probe.
I'm so glad I had a chair today.
Yeah. No, but it's true. It is true. You shouldn't feel lucky. You should just be like, it sounds like they didn't have a nurse before, so that's why they feel like that, because I think they were a lone worker for a while.
Fair enough.
They're having difficulty scaling the right-hand side, especially lingually and palatally. You're thinking about the patient.
Yeah.
So lingual, palatal on the right-hand side. Now that there's 2 of them, they're finding that they're feeling a bit restricted on one side, and access is tricky. Obviously, because they've been a sole operator for a while, they're trying to unlearn the habits they had as a sole operator.
Yeah.
And they feel like actually their treatment is suffering because of it. So the level that they felt that they were getting to pre-nurse was maybe higher than now because they're struggling to get the access. Any tips on how they can position themselves to be able to get access to the lingual and palatal?
Yeah, so actually, if you are working by yourself, okay, what always happens, you've got the patient here, head, so you maybe work at like 12 o'clock, don't you?
Yep.
For the majority. When you want to do the palatals, you aspirate in and then you do this. So you work like this for 8 hours. So yeah, you can do it because you're doing direct vision.
Yeah.
Yeah? Or if you want to do the linguals, you're over on your side.
Yeah.
But when you've got a nurse, you can't do that because you can't lean over.
You're in their way.
So yes, it's uncomfortable to start with, but it's actually much better for you.
Yeah.
What my nurse does is I usually sit around about 11 o'clock for the majority of it. Mm-hmm. My nurse is usually like 1 o'clock-ish with the aspirator. When I come to do the lingual on the lower right and the palatal on the upper right, I get the patient just to move the head slightly to the right so you can see.
Yep.
I move around maybe 12 o'clock.
Yep.
She moves around maybe 4 o'clock, 5 o'clock.
Trying to think of the
and then
clock
she'll
face, yeah.
use her left hand to bring the aspirator around the front of the patient.
So now they're coming in at the front, okay.
And retract the cheek out.
From that side.
Yeah.
Yeah.
And then I can then use my mirror to pull the tongue back, and then I go around the right-hand side. And the same for the uppers.
Yeah. Do you know what I think helps me as well is using loops a little bit. I think because when you're using loops and everything looks a little bit closer and you can sort of sit upright a little bit more, I feel like I think,
yeah. Go on, sorry, I was interrupting you. I'm just thinking in my head.
I feel like that definitely helps me. It's the indirect vision, isn't it, that's allowing you. So basically, whilst you were a sole practitioner, you didn't have a nurse, potentially down the line, you were going to really end up suffering. So almost in a way, it's a good thing you've got someone there that's making you having to think twice. I think having the loops will make your standard of work feel like it's as good as, because you're able to see a lot more and your posture's going to probably be better in the first place. I'm just trying to think now. It's like when I'm doing my treatment, I don't know how qualified, they're obviously very qualified, but how long they've been qualified, because I find that I can do a lot more in my mirror than when you first qualify, and they're always saying to you, try and do it in direct vision, and you're like, I think over time you actually start learning how to use your mirror a lot more and stop trying to look at the teeth themselves.
Yeah, because I think sometimes they're like, oh, it's misting on the mirror. I can see perfectly fine. Like I might be able to see 1/10 of the mirror, but I can still see what I'm doing.
Yeah.
But I think when I first got my loops, I was like, oh my God, these are amazing. Like I can see everything.
Yeah.
And my posture was really good because I wasn't moving my head that much.
Yeah.
Now I've got them, I can still like move them around because I'm familiar.
Yeah.
What do you think of, have you tried those ergo loops?
The ones where you literally look like you're staring at the ceiling. It's very odd when you see someone wearing them.
Yeah.
I think they're actually meant to be amazing for your posture because you're very much upright. But it genuinely looks like you're looking straight ahead, but obviously you can see in the patient's mouth. I've not actually got them. I've never used them in like clinically, but I've worn them and
I've seen them. I think they look really cool and I like the idea.
Yeah.
And they will keep your head up because you can't really tilt your head when you've got them on, surely.
Yeah. So it probably is going to be very good for you, but no, I haven't got them. The other thing as well is you touched on it a second ago, but going back to the agony aunt, agony uncle question, getting the patient to move their head. I think we forget that the patient can move. I spent years just working around the patient and letting the patient sort of keep their head in one place. And now I'm like, move your head here, move your head there, like getting them to move their head. So if they're tilted all the way to the right-hand side, you could definitely see a lot more. Now, yes, your nurse might have to lean over a little bit more to have a look, but it definitely
But then
helps.
it goes the other way because it's a lot easier when they turn to the left.
Yes. Yeah. So they get like a bit of more of a respite on the left-hand side. I've had times though, we've all had times where my nurse is like over the top of me and stuff like this. What I sometimes do when I'm in those difficult to reach areas and I know I'm just in my nurse's way, you know, when you have to just get that direct vision and you're like, I'll actually say, I'm really sorry, just give me 2 seconds. I'll get the patient to turn their head. I then take the aspirator off because I use the Pure Vac as I've mentioned before, and I'll just quickly do it myself. And then on the last podcast, we heard
Don't be offended.
we heard that my nurse was offended. But when I do take the aspirator off them, because I'm saying like, oh, for a second, let me just take this off you whilst I'm doing this side. You're not doing anything wrong. I'm just, I just need to see a little bit more and I'm going to be in your way. it's just for a couple of seconds or a couple of minutes, and then they step back, I just do it, and then I give it back to her and I carry on, So it comes down to communication a bit. So,
Whatever works, I think. But yeah, certainly if you think about the clock face, that helps a lot.
Yeah. But it is hard when there's two of you in a very small space, especially when you're in a really tight surgery. We're usually in the surgery under the stairs, aren't we? So it's a really tight space.
Oh, I've got one of the biggest.
Oh, have you got a big one? Oh, they love you.
I was in my
surgery.
little room, surgery 2. RIP. I was in that room from when I started, so 2012 to maybe last year. So I was in there for 11 years.
Yeah.
And then there was a surgery downstairs. Yeah, there was a surgery downstairs. And I moved into that one. And I was like, oh, this is amazing. It's so big.
Yeah.
But my surgery upstairs used to look out onto the garden. It was really warm as well. Whereas the one downstairs is freezing cold.
Yeah.
So obviously it doesn't get the sunlight as much. There's still a window, but it doesn't get the sun. So now all my patients are like, ooh, you've had an upgrade. And I'm like, not so sure. It's absolutely freezing in here. But
yeah,
I've got quite a big room now.
Yeah. So I'll tell you a funny story. So I was working at a practice. It's not a funny story at all. It's typical. I was working at a practice and I usually worked in one of the surgeries downstairs. I was happy with it. It wasn't small, it wasn't big. It was just normal. Sometimes you don't need that excess space. It's just wasted space, isn't it? So it was just fine. And then I went to work upstairs in one of the new surgeries that had been built, and it was massive. And they got a new dentist in. And it was the nicest surgery because it was the new one as well. It had the new chair. It was like already plush. And I liked working in there because it had like the one downstairs, because they'd done an extension, I didn't have any windows. So I'd gone from having a really nice window with the garden to like no windows. I mean, by the end of time there, I was like, I'm sick of not having a window. But the upstairs one had one.
Did it not give you like a banging headache?
Yeah, from the lights. I even wanted just a TV on the wall where I could have like some sort of outside scenery on the TV, so it looked like I had a window at least. But anyway, I was putting this surgery upstairs, and then we got this new dentist, cosmetic dentist, if that's even a terminology, and he said, how come you're in here? Like, I want this surgery. He was like, why is the hygienist in the nice surgery? I was honestly, like, do you know what? I was like, you can have it. I'm not even gonna like
ego.
So I could only get my unit in 3 surgeries. There was quite a lot of surgeries, and there was only 3 like air plugs. So it was that one downstairs or one upstairs. And I was just like, I'll go back to the one downstairs. It's fine.
It's just not worth arguing, but just the ego, and like an arrogance of why are you in here and I'm not.
I just remember being like, wowzers, okay. But it was a lot of wasted space in there. It was nice having the big surgery and everything, but I was like, you could put another surgery in. It was that sort of big. But yeah, I just wanted a TV on the wall. Yeah,
I've got a TV. I used to have 2 computer monitors upstairs, but now I've got a TV and a computer. So that's quite nice.
Yeah. I think TVs are good because you could put like information on the TV for the patient, or they can watch
radiographs up.
Get the radiographs up.
I feel like I'm doing like a little presentation every time. And I'm like,
stand up
and
lecture.
This shadow around here? And they're like, yeah. Because sometimes on the computer, I mean, I don't know what everyone else does, but sometimes people don't even go through the radiographs. Whereas if I take radiographs, I usually bring it up and say exactly what each thing is and what I'm seeing.
Yeah.
I'm doing that so my nurse can also type the radiography report down.
Yeah, that's a good idea.
But I'm just going through it with the patient. But when you have it on like a 32-inch TV, it's like, oh my God, okay, that's a big hole.
Yeah, that looks like a big hole. Yeah. That's a lot of bone loss.
It's a lot of bone loss. And like, yeah, it's a lot.
Yeah, that's a good idea. I like that a lot. For giving them the information.
What's your Skrubz like?
Oh, gosh, we have not even looked. Oh
my God.
That's actually really, really good, isn't it? What do you think, producer? Is it all good? Yeah. I'm really impressed with that, because otherwise, if that was the other Skrubz, I'd be like discoloured.
I'm impressed. Well, your other Skrubz.
And they're ruined unless I want to walk around with big handprints on my butt. So if you liked this episode, like, comment, share.
Follow on YouTube, message us on Instagram.
Subscribe on YouTube. Yeah, message us on Instagram. Tell us what you want us to talk about. We are here to help you with Agony Aunt, Agony Uncle, and have laughs with you. Send us your funnies. We like the funnies. The funnies are my favourite.
We love the funnies and the gross ones.
Yes, send us the gross ones. Funnies and gross ones. We want more of them. So yeah, see you next time.
Bye.